Good afternoon to all, and warm greetings to all from Nepal. So, this is Babu from Patan Academy of Health Sciences, Nepal. In this webinar, I will be presenting on topic exercise induces favorable metabolic changes in white adipose tissue, preventing high fat diet obesity. Obesity is a leading public health challenge worldwide. It is an established risk factor for metabolic diseases and several types of cancer. And this is preventable through lifestyle modification, through diet and exercise. And exercise have a beneficial effect irrespective of weight loss. Therefore, WHO recommended physical activity of 150 minutes per week of moderate intensity exercise or 75 minutes per week of vigorous intensity or an equivalent combination of both. These exercise in general have effect on the adipose tissues, and it increase mitochondrial activity, decrease cell size, lipid content, reduce inflammation. In rodents, increased presence of thermogenic brown like adipocytes or base cells. In particular, the endurance training was able to reduce adipocyte size, inflammation, collagen deposition in AP, increase mitochondrial content in SAT, AP, and BAT. High-intensity interval training elicited similar metabolic benefits to end in a shorter duration, and higher HIIT has a greater reduction in metabolically damaging abdominal fat in obese animals. So although there is literature on the effect of exercise and adipose tissue, and the knowledge is limited on the role of exercise to prevent the changes in different fat deposits in preventing weight gain when high fat diet and exercise were commenced together, and also the differential effect on them. Therefore, we aim to investigate the ability of endurance and high-intensity interval training to prevent whole-body metabolic changes in three adipose tissue deposits, that is SAT, subcutaneous, epididymal, and brown fat, on the markers of adipogenesis, thermogenesis, inflammation, and fibrosis. We hypothesize both HIIT and END would have overall benefits to white and brown adipose tissue metabolism, and HIIT would be of greater benefit to white and brown adipose tissue metabolism than END, as it is more intense, vigorous physical activity. So to carry out our study, we recruited C57BL6 mice of 10 weeks age and 1 week of acclimatization on treadmill. We divided them into 6 groups, 3 in chow, 3 in high fat, and each group containing 12 mice, and untrained, endurance, and high intensity interval training. And we did in treadmills, and both END and HIIT exercise were carried 3 sessions per week for 10 weeks for 40 minutes duration on each session, and the speed was 70% of maximal running capacity for endurance and 50% of maximal running capacity for 2.5 minutes and 90% of maximum running capacity for 2.5 minutes, alternatively in HIIT for the 40 minutes. And we did carry out metabolic phenotyping study in metabolic case, where we measure the energy expenditure and physical activity, total body fat by echo-MRI, and insulin tolerance test to measure insulin resistance. And the other 10 weeks we euthanized and collected 3 fat depots, liver tissue, blood from cardiac puncture, and were stored at -80°C, and then were used for the uh, mRNA study and protein study and various histological studies. And mice refusing to run more than twice in the same week were retired from the experience, and 2 were from end and 4 were from HIT. Those were retired. In results, as expected, there was weight gain with high fat diet, and which was increasing subsequently with time, and it was significantly preserved. Weight gain was preserved in high fat fed animal with both exercise, and such significant effect was not seen in chow. Consistently, the lean mass was also decreased in the high fat fed animals, and it was preserved with the both exercise programs. And consistent with these two changes, there is increase in insulin tolerance tests with high fat diet, suggesting development of insulin resistance, and it was preserved with both the exercise. Another anthropometric and metabolic phenotyping parameters shows consistent pattern. All the fat masses like total body weight, total fat, SAT mass, AP, and liver mass were increased and were partially controlled with the exercise, and fasting blood glucose and insulin was increased, and it was partly reduced by endurance exercise but not with HIIT. Interestingly, the physical activity was reduced in high fat animals, and also the energy expenditure. This also explains the increase in body weight in high fat mice, and exercise seems to have no significant effect on this, although there is some trend of the increase. Consistent with the changes in adipose tissue mass, we can see that with high fat feeding, there is significant increase in adipocyte size of SAT, AP, and also the lipid deposition in brown adipose tissue. In bat, this lipid deposition was significantly reduced with exercise, and SAT also the adipocyte size was significantly preserved with the both exercise, but in EP that was not observed. Consistent with the adipocyte size increase, there is increase in the p-bar gamma mRNA, the adipogenic marker in SAT, and it was controlled by the both exercise, while in EP, though it was increased with high fat diet, exercise did have any significant effect, and in PAT the effect was minimal. Another adipogenic marker were also increased with high fat diet in both SAT and EP, and it was minimal changes in BAT, and it seems there is significant effect of the both exercise in these adipogenic markers as well. And adipogenic marker we used were TLE3, adiponectin, leptin, resistin in all 3 fat depots. Another marker we chose were thermogenic markers, because the thermogenic markers were believed to be increasing the improving the metabolic health. And also there is emerging concept of brown adipose tissue in white adipose tissue like SAT and EP. So we have seen the effect of these thermogenic markers on the base marker in white adipose tissue, and also the thermogenic markers in brown adipose tissue. But counterintuitively, we can see that although the insulin resistance was increasing with the high fat diet, we saw the increase in UCP1, PRDM16, protein with high fat diet in both SAT and AP, and it was preserved with the both exercise. And in BAT, high fat diet just increased the UCP1 and no significant effect of exercise were observed. And other thermogenic markers were also significantly increased with high fat diet, and also TBX15 in the EP, and it was preserved with the both exercise, and in BAT the minimal effect was observed. In contrary to what we have seen the mRNA, the EP UCP1 and EPPRDM16, we can see the reduced protein level despite increased mRNA levels and exercise preserving them, which is contrast to the mRNA finding. But it is consistent with the in our case with the changes that we see in the insulin resistance in the high fat diet. But in SAT, we didn't see any significant changes either with the high fat diet or exercise. In BAT, we did see consistent change in increase in the UCP1 protein with the high fat diet, as we saw the increase in UCP1 mRNA. But exercise doesn't have any significance here as well. And another aspect we chose was Ecm Remodeling, because this also has significant role in development of insulin resistance, because if adipose tissue are not able to incorporate the excess fat in the body, then they will be deposited in the peripheral tissue, and it renders the insulin resistance. And this decrease in ability to expand inner adipocyte is due to the fibrotic changes. So in this also we can see the fibrotic changes of AP with the high fat diet and exercise were able to preserve the adipose tissue Ecm remodeling, and in BAT and SAT we didn't see any significant change. However, in SAT we saw the mRNA change of collagen was significantly increased with high fat diet, and it was significantly preserved with exercise, and same with the AP. And in BAT, not significant changes were seen. Similarly, other Ecm remodeling markers were significantly elevated in SAT and EP and were preserved with the both exercise. And BAT, we saw the minimal changes. And the marker we used were TGF-beta1, CCN2, TIMP1, and TIMP3, which are involved in Ecm remodeling. And other aspect which we used were inflammatory markers, because increase in inflammation is also involved in development of the insulin resistance. And we saw that with high fat diet, where we have seen the development of insulin resistance, there is increase in inflammatory markers in all the adipose tissue depots, and it has been significantly preserved with the both exercises. And consistently in SAT, CD45 protein was increased with high fat diet and exercise were able to preserve, but in EP and BAT we didn't see such consistent changes. In summary, in high fat mice, both exercise programs decrease weight gain, total body fat, SAT, liver, AP mass, preserve lean mass, increase insulin sensitivity, reduce adipogenesis, reduce inflammatory changes in SAT, AP, and BAT, reduce fibrotic changes in SAT and EP, preserve UCP1 and PRDM16 protein in AP. In conclusion, this study establishes the beneficial effect of both HIIT and END exercise in preventing metabolic deterioration, collagen deposition, and inflammatory responses in fat depots, resulting in improved whole body insulin resistance in high fat diet mice, which is consistent to what we hypothesized. But in contrary to our hypothesis, we were unable to see differential effect of heat and in the adipose tissues, but we were able to show the depot specific effect of diet and exercise. So I'd like to acknowledge Astral Award for enabling me to conduct this study, and Killian Diabetes Fund in Sydney Medical School Foundation of University of Sydney, Endocrinology Trust Fund of Royal Prince Alfred Hospital Sydney, my supervisor Associate Professor Paul F. Williams,